Okay, my presentation is about, is this medical technology really saving lives? And my one quote that I use for my main overall presentation and my paper was by Abraham Lincoln, and it said, next to creating life, the finest thing a man can do is saving one. And this medical technology that I'm talking about is like 3D printing, precision medicine, virtual reality, stroke visors to detect pre-hospital strokes, and Lucas machines that do CPR for you. Some 3D printed objects that we use today are implants, joints, cells, and prosthetics. But 3D printing was like on the go before it came into the medical field. Also, a cool thing about the 3D printed objects is it is extremely accurate in size, and that we can transplant artificial organs. Robotic surgery gives surgeons assistance, and it makes it faster and doesn't give such a hard recovery, and it improves surgical outcomes dramatically. Precision medicine is where they take all of the medication that we need, a patient needs for one disease, and combine it into one, and it targets that certain area. And it can also treat cystic fibrosis. DNA cutting is weird, but it's cool. It actually cuts a part of the DNA out that is infected with cancer or HIVs or anything, and it will replace that part of the DNA with a different letter. And virtual reality is something that is used all over colleges for medical school, nursing school, and they also use it to educate patients of how they are doing their procedures and surgeries. A stroke visor, they use it in only high-tech ambulances. They use it and they put it on a person's head, and it straps around, and it scans all the way around to detect a stroke. This is the Lucas machine that I'm talking about. It goes 5 millimeters deep into a person's chest, and it can pump 100 times, with the person that is giving CPR can only do it for 2 minutes, and then they have to switch, which this, you can just leave it running the whole time and you don't have to switch, and it doesn't tire you out. This AED defibrillator, they have it in all public places. Every business, restaurant, everywhere has one of these in case something happens. It's a protocol to have one. And 2 patches go on you, and it's to shock your heart. This ICD defibrillator, it can go in you and help reboot your heart to go back to a normal rhythm. And overall, is this technology really saving lives? And I think yes, because it's more efficient, overall safer, and faster results, and can be accessed within minutes in hospitals. And those are my references.